Kanappa Shetty, sir.
Well, am I audible?
Yes, sir. Good evening, sir.
You are audible.
Yes, good evening, sir. Thank you. Thank you very much for giving me this opportunity. So, however, I would like to clear myself with the current topic. I was asked to talk on generic social work, scope and objectives and roles and responsibilities, not specifically to focus on medical and psychiatric social work. So, mainly I'll be focusing on, generic social work, roles and responsibilities. Thank you. So, let me share my slides. Just give me a minute. I'm just sharing the slides.
Yes, sir.
Just see, sir, whether slides are visible.
Yes, sir.
Yes, sir.
Thank you very much. As you are aware that I am Kannappa Shetty, faculty in the School of Social Work, New Delhi. Let me briefly give you the scope, roles and responsibility of generic social workers, and predominantly for BSW, MSW, and some certificate with social work degrees. So we can have a brief discussion. I mean, I will give you a brief orientation. Later, we can have discussion as well. So, what are the major learning objectives of my talk today? Define generic social work and understand its broad scope. Identify major roles performed by generic social workers. Explain key professional responsibilities and ethical applications. Recognize core skills and competencies required for effective practice, and explore contemporary fields and emerging career opportunities. And let me understand, let me give you brief information on the meaning of generic social work, so that we can clear our terminologies and the specific meaning for that. Generic social work refers to professional social work practice that applies a common knowledge, very importantly, common knowledge, values, skills, and methods across all diverse settings. So you can take it even medical and psychiatry as well. But irrespective of the specialization, here the common thing is common knowledge, values, skills, principles, and methods. And it is not restricted to one specialization field such as psychiatry, medical, or school or correctional or any other social work specialization. The generic social worker assesses needs, mobilizes resources, facilitates change, and promotes social functioning. Practice may occur at individual, family, and group, and organizational and community level. And specifically, who is generic social worker? A trained professional social worker who works with people experiencing personal, family, social, economic, and community-related difficulties, uses professional knowledge, communication, assessment, intervention, and resource linkage skills, works with individual, families, groups, communities, and institutions, promotes empowerment, participation, inclusion, social justice, and improved quality of life. And what is the scope for generic social workers? It could be BSW, it could be MSW, or even the PhD with generic nature. So individual and family services, community and development and community organizations, child, youth and family welfare services, women welfare and gender-based support system, support services, older persons and disability services, nothing but geriatric population and disability services, health, mental health, psychosocial services, education, school-based services, substance use prevention, rehabilitation, and other treatment-related facilities or services, correctional, legal aid and rehabilitation services, NGO, CSR, government, developmental programs, and nowadays there is a lot of scope for social workers, even environmental related services, and major field for practice, especially for generic social workers, health and hospitals, mental health, community care, schools, colleges, universities, child protection, family services, community development and rural development, disability rehabilitation, gerontological social work, substance use services, correction and probationary services, corporate CSR, employees assistance programs, disaster management and humanitarian services. So generic social work method. So here, what are the methods we are going to discuss? All of them are same for other specialization and other related interventions. So social case work, we are aware that social group work, community organization, social action, social welfare administration, social work research. So all these 6 methods are common for other specializations as well as for generic social work interventions as well. So now mainly we'll discuss on what are the major roles of social workers is in terms of generic social work interventions. The first one, as a counselor. So generally most of social workers, when we are doing BSW or MSW or other certificate programs, so we do practice or we do get trained as counselor. So in that, build a professional helping relationship, listen actively and understand the person's concerns, provide supportive counseling within professional competency, help clients explore options and make informed decisions, refer clients to specialized professionals when required in terms of medical and social work, psychologists or any other specializations. In case if we need that, so we will refer it. So we are aware that counselor job, and we do extensively do it when there is a scope and need. So whenever we do social work programs like BSW and MSW, counselor job is very common. Very often we do go for supportive counseling, crisis counseling, and a number of generic counseling methods. And next role is case manager. As a generic social worker, many times we get this job or role whenever we do practice or whenever we get a job opportunities. So mainly there to conduct a comprehensive assessment of needs and strengths, develop an individualized services or intervention plan, coordinate services from multiple agencies and professionals, monitor progress and follow up and referrals, maintain appropriate documentation and confidentiality. So as it is a very generic roles and responsibilities, we will be having very generic and common roles and responsibilities and this particular case manager role. And next one is facilitator. This is also very often we do get this job when we go for organizational related aspects or even NGO related services. So mainly they create opportunities for individuals and groups to participate, encourage communication and problem solving, support clients to identify their own strengths and solutions, facilitate access to services and schemes and community resources, promote self-reliance and rather than dependency. And next one is advocate. Of course, many times we do go for various levels of advocacy, and it's again a very common and very important roles of social workers in terms of generic services. So mainly they protect and promote the rights of vulnerable and marginalized people. We know that there are a number of marginalized sections across the country. So many of our social workers are working there and help clients understand their entitlements, available services, represent client interest when appropriate and within informed consent, and challenge discriminatory practices and barriers to services, promote social justice and equitable access to resources. So our next role is mediator. Help people manage the interpersonal and family conflicts, maintain the neutrality and create safe space for dialogue, clarity issues and encourage constructive communication, support mutually acceptable solutions where appropriate, refer complex legal or high risk matters to competent authorities. So many times many of our social workers are working in the field of marriage and family counseling services, and many of them are working as social workers or counselors or mediators in family counseling settings, especially in urban areas. Community mobilizer, another very important role for generic social worker. identify community needs, strengths, and available resources, encourage participation of local people in decision making. So build community group and networks, mobilize local and institutional resources, support collective action for sustainable social change. So I would like to give an example of my own state, Karnataka. Recently, I have visited for one examination purpose, and many social workers are working in a gram panchayati level and even obli or black level in terms of community mobilizer, basically for implementing government schemes and government programs there. So this is again in a big way, is coming in a big way for generic social workers, especially for BSW and MSW in rural settings, especially in the rural areas. Educator and trainer, another very important role for generic social worker. Provide information on health, welfare, rights, and social issues. Conduct awareness programs and life skill sessions. Train community volunteers, peer educators, and service providers. Develop educational materials and communication strategies. Promote preventive and developmental approaches. We, especially from IGNO and many other universities, we offer generic social work programs. In a BSW and MSW and diploma levels. So many of them go for this kind of job only, not very specific or specialized jobs. So researcher, again a very important role for social workers. Identify practice and community problems requiring systematic studies. Collect, analyze the information using appropriate methods. Evaluate programs and interventions. Use evidence to improvise professional practice. Disseminate finding ethically to relevant stakeholders. Here, so I could see a number of research projects in state and district, even super specialty hospitals. Predominantly, they are going to hire generic social workers for specific roles, especially to liaison with the different stakeholders, or to collect the data, or to entry data. Their job is very limited, and of course, they are also aware that their skills are very limited. So they do take basic and generic social workers for particular role, like entering data, collecting data, visiting communities, or conducting FGDs or case studies, or go for a kind of negotiations, or linking with different organizations, liaison with different organizations. So whenever there is a small research project, they do take for social workers for specific role, unlike medical and psychiatric social work roles here. So coordinating and linkage agent, as I mentioned, so there is a lot of scope for social workers in this area. Develop working relationship with the agencies and professionals. Connect clients with appropriate government and non-government services. Coordinate multidisciplinary intersectoral interventions. Reduce duplications and gaps in service delivery. Strengthen referrals and follow-up mechanisms. So change agent, so very generic role. Identify personal and family, organizational and community barriers. Support clients and communicates to develop achievable goals, change goals. Promote empowerment and participation. Challenge harmful practices and exclusion. Facilitate sustainable changes at individual and structural level. So responsibilities, predominantly, what are the responsible for generic social workers? Conduct professional assessment and identify needs, strengths, and risks. Develop and implement appropriate intervention plans. Maintain accurate and confidential records. Make appropriate referrals and follow-up services. Collaborate with multidisciplinary teams. Monitor and evaluate interventions. Participate in programs, planning, and community development. Maintain professional boundaries and accountability. So now ethical responsibilities is very common for all kind of social work professionals. So especially for generic social workers, respect dignity and worth and self-determination of service users. Maintain confidentiality and privacy. Very important ethical responsibility. Obtain informed consent where applicable. So especially nowadays, informed consent form is compulsory for all kind of interventions or assessments. Practice without discrimination. Maintain professional boundaries. Recognize limits of competence and seek supervision or referrals. Use professional power responsibility. Maintain accurate records and protect clients' information. That's very important. And follow professional codes, organizational policies, and applicable law. So we cannot say that generic social workers cannot, they should not practice or follow the ethical responsibilities. And everyone is a professional here. So right from BSW to PhD level, so they have to follow ethical aspects. Core skills and competence of generic social workers: communication, active listening, assessment and interviewing, counseling and helping skills, case management and documentation, group facilitation, community mobilization, advocacy and negotiation, conflict resolution, network and teamwork, program planning and evaluation, research and digital literacy. and professional responsibility across levels. Micro, we are aware that, and meso and macro, and across all levels, ethical practice, documentation, supervision. Especially supervision is very important for generic social workers as they are not specialized in medical or psychiatry or correctional settings. So they do need supervision from seniors or faculties or any other superior social worker. Challenges in generic social work practice. So this is very important aspect. Social workers will, especially social workers will do have a lot of challenges when it comes to their generic practices. So I think many of social workers, they do understand and they do overcome all these challenges by taking help from seniors or specialized social workers and from faculties. The very important challenges in terms of generic social work practice, especially in India. High and diverse caseloads. There is a lot of caseloads and limited resources and services gaps and complex and interconnected social problems, stigma and discrimination. We know that and there is a lot of stigma for social work job, and each and every social work, like a politician or a person in the community, they themselves call as social workers. So there will be a lot of difficulties to recognize who is professional social worker and who is not professional social worker. And people say that each and every person in the village or in the NGOs are called themselves as social workers. So this is and the moment you say you are social worker means they will have their own negative ideas. And role ambiguity and unrealistic expectation. Definitely there is a lot of role ambiguity between the generic social workers or medical social workers or psychiatric social workers, or even with nurses or even with psychologists. So many times we do see psychologists applying for social work job, or for social work job MSc psychology or BSc psychology or psychology courses are kept mandatory. So a lot of these kind of ambiguities are there. And coordination difficulties across agencies. There is a lot of challenges because when you are working in a hospital setting or medical setting, many times we may not be knowing the jargons of medical sciences or their higher levels of knowledges. So when you are coordinating with the neurologists or psychiatrists or medical specialties, it will be difficult for generic social workers. Many social workers coming from mother tongue will be difficult to understand different jargons. And emotional demands and risk of professional burnout. Of course, this is very high, and need to continuously update our knowledge and skills. This is very important. So we need to have a continuous, probably these kind of sessions to update our knowledge and the skills. And emerging scope and career opportunities for generic social workers. Community-based mental health and psychosocial services, CSR employee well-being programs are increasing like anything, and NGO development sector programs are there. And digital social work services. So this is again another happening field for generic social workers. And disaster responses, humanitarian assistance, disability inclusion and accessibility services, child protection and safeguarding. So many social workers are getting into UK or different countries for child-related interventions, public health and preventive programs, research, monitoring and evaluation, social entrepreneurship and social innovations. These are all emerging opportunities for generic social workers. And what is the framework for generic social workers, especially for practitioners? Assess, very important. Plan, intervene and coordinate, evaluate, close or follow up. So this is a kind of framework for generic social workers wherever they would like to practice it. And key takeaways: generic social worker has a broad and flexible scope across sectors and populations. And social worker performs multiple interconnected roles rather than a single role. Effective practices combines professional knowledge, skills, values, and ethical responsibilities. Empowerment, participation, social justice, human dignity are central practices. Continuing learning, supervision, teamwork, evidence-based practice strengthens professional effectiveness. Thank you.
Thank you so much, sir. A very enlightening session, and you have covered very in depth the role of social worker in generic setting, and you have also covered the responsibilities as well as what are the problems they are facing in day-to-day life. So we'll take the question answer and your recommendations and your suggestions at last. I'm going to invite Dr. Senthil M, who is Assistant Professor in Department of Psychiatric Social Work in CIP Ranchi, is going to cover a topic of role of psychiatric social work in community and clinical setting. Just giving the information that this links might be expired in 1 hour. So we are going to provide a new link also in the message. Yeah, it is requested to all the if it ends, then you can join in that new link. Thank you all. Thank you. To hand over to Dr. Senthilan.
Thank you, Dr. Prasant. First of all, I would like to thank the organizers and the office bearers of ISPSW, especially Dr. Prasant and Bhupender sir, Naren sir, and Atavullah for giving me this opportunity. And also, I'm very happy to virtually joining with Dr. Kannappa Setti. Hi, Kannappa. Hope you are doing well.
Yes, Senthil, I'm doing well. Thank you. Thank you. I could
Thank
able
you.
to
Thank
see
you.
you and talk to you after a long time.
Yes. So a long time actually. Okay. I'd like to share my presentation, and then my topic of the presentation is scope of medical and psychiatric social work. Let me share my screen. Can anyone tell me, Atavullah, whether my screen is visible? I'm opening my screen.
Yes, your
Yes.
screen is visible.
This PPT is visible, right?
Yes, visible.
Okay. So as you can see, the scope of medical and psychiatric social work. And to start with my presentation, we know that the social work is a professional service based on scientific knowledge and skill in human relation, which assist in individual alone or in a group to obtain social and personal satisfaction. So, in the field of psychiatric social work, what we can do is we have to apply the social work skills and knowledge in the field of psychiatric social work. So, when we talk about psychiatric social work, many people think that the role is limited to only counseling the patient in a psychiatric hospital. But actually, the scope is much broader. A psychiatric social worker can work in hospitals, even community mental health programs, de-addiction centers, child guidance clinics, correctional setting, and many other areas. So, in this presentation, I will discuss what the psychiatric social work is and the different roles of a psychiatric social worker, the areas where psychiatric social worker can work, and different intervention that we can provide with the patients, families, and even in the community. And also, I will discuss a little bit about the rehabilitation and the challenges and the future opportunities. Right after completing the psychiatric social work, what are the opportunities which are available in India? So, before discussing the psychiatric social work, yes, how this what is it? This psychiatric social work. Who is a psychiatric social worker? See, this Mental Health Care Act 2017 very clearly it has stated to call oneself as a psychiatric social worker, one must have completed MSW and MPhil in psychiatric social work. So before this act, those people who are working in the field of psychiatry hospitals, after completing Master of Social Work, they can claim themselves as a psychiatric social worker. But after this act, what is mandatory is the completing MPhil in psychiatric social work is very much mandatory. So, the psychiatric social worker is not working alone, he is working in a team. This is called a multidisciplinary team. So it is consist of a psychiatrist.
Getting feedback. Sorry, sir, getting feedback.
Sir, if you have any queries, I request you to kindly ask me at the end of my presentation.
Minhas, please.
Any questions? I am happy to take your questions at the end of my presentation. So kindly you can take a notes actually wherever you have any questions and clarification, you take a notes, right? Okay. So so multidisciplinary team should consist of a psychiatrist, psychiatric social worker, clinical psychologist, and psychiatry
Your voice
nurse.
is echoing. Your voice is echoing.
Okay, the voice is echoing. So voice is not audible for all others.
Hey, it's audible for us. It's audible for us. It's a fine.
So those who have a problem in what is audio, so kindly check. I think for others it is okay. So okay, so I am continuing with my presentation. So fields of psychiatric social work, you can see in my introduction also I told you that actually the psychiatric social worker not only working in the psychiatry hospitals, the psychiatric social worker can work in various settings. So such as mental hospitals like CIP, Manch and LGB, etc. And the psychiatric social worker can work in psychiatric clinic also, a private psychiatrist who can run the psychiatric clinic. A psychiatric social worker can work in the department of general hospital and medical colleges where there is a department of psychiatry where he can work. In the psychiatric social worker can work in de-addiction center, community mental health program, child guidance clinic, correctional settings, and so on. You can see there are various scope, right? The psychiatric social worker can work. The scope of psychiatric social work, right? The mental illness is influenced by multiple factors. There can be a biological factor, psychological factor, and social factor. So the psychiatric social worker mainly focuses on understanding the psychosocial context of the illness. We ask what is happening in the family. So while working with the patient and the family, we ask these questions, right? What is happening in the family? What social support does the patient has? Is the patient is employed or not? So there are various questions that we ask, we collect, and then after collecting those informations, then we make psychosocial intervention plan. So, for example, if a patient repeatedly stops medications, we should explore why the patient is not able to take medication continuously. Instead of telling that the patient is non-compliant, we can ask whether the patient is not taking medication because of a socio-economical barrier, or the patient is having problem in taking medication, or the patient is experiencing any kind of side effects. So the psychiatric social worker has lot of scope, and then so we can address those areas. We are also addressing the caregiver burden also. We are not only working with the patients, we are also working with the family caregivers who are going through a lot of difficulties while caring the patients. In the field of mental health, especially a patient who is having or who is suffering from schizophrenia, the family caregivers, they go through a lot of caregiver burden. So in some time, they may develop some kind of mental health problem because of their excessive caregiver burden. So we are not only working with the patients, we are also working with the family member also to address their mental health related issues. We are also working not only providing counseling or any other intervention. After providing the intervention, the psychosocial intervention, we are also thinking or doing the rehabilitation work, which I will discuss in detail in the coming slides. So role of psychiatric social workers in the psychiatric setups that you can see, majorly we are working in the 4 areas. One is about the curative services. Another one is the preventive service. The third one is promotive. And the fourth one is rehabilitative. So we will discuss one by one. So what is curative? So curative role focuses on the person who already has a mental health problem. So we begin with an intake interview. We will do a proper interview to understand the patient's problem. And we also do psychosocial assessment, which will help us to understand the patient's problem in psychosocial aspect so that we can provide psychosocial interventions. We collect information about the family and their details. If there is any problem in the family which is causing the patient's mental health problem, so that also we assess. We also assess the occupations of the patients, and the finances, the sources of the income that they are getting, and the relationship and social support. So based on this, what we do is we formulate a psychosocial understanding, or we make psychosocial diagnosis, then we will do the psychosocial interventions. So depending on the need, right, the need will vary from person to person, the patient to patient. So the psychiatric social worker may provide psychoeducation, counseling, family intervention, crisis intervention, for example, motivational interviewing, motivational enhancement therapy, CBT, and all other the group therapy, social skill training for schizophrenia patients. So based on the patient's problems, we choose we choose the intervention plan. For example, a patient who is taking substance, so we may go with motivational interviewing, we may go with motivational enhancement therapy. For a patient with bipolar affective disorders, we choose IPSRT. For a patient with schizophrenia, we do social skill training. So all these things are coming under curative role. Then we are moving to preventive role. In prevention, what we do is, this is entirely the opposite. Prevention means the trying to stop a mental health problem from developing. So, or from worsening the illness or recurring the illness. So it is about preventing the illness or the early identification or the signs and symptoms, that one can early identify. So early identification is important because we can intervene before a problem become severe. So that comes under preventive role. Even we also do suicide prevention, which is another important preventive role. We also do relapse prevention for a patients with mental illness. So relapse prevention not only for a patients with substance use disorder, even for a patients with schizophrenia or patients with bipolar affective disorder, where the patient may come and take medications, and then after discharge, the patient may not take medications, which may lead to relapse. So to identify this relapsing factor is very important. That also comes under prevention. Then comes the promotive role. So promotion focus on the strengthening the positive mental health. So what is positive mental health? Such as the mental well-being, life skill educations, resilience, right? The positive factors, or you can say the protective factors. So the promotion is to work with the protective factors such as resilience, self-esteem, social support. So that comes under the protective factors. And to work with the risk factor, that comes under the prevention of mental illness. For example, if you work with poverty, if you work with poor coping skills, or if you work with unemployment, so so that comes under prevention of mental illness. Then the last one is rehabilitation. So rehabilitation begins with an important question. So what happens after the acute symptoms? So for example, after treating the patient, then what happens? A patient may become clinically stable, right? After treating the patients may become better, but still the patient may have difficulty returning to work, right? He may not be able to return to his work. He may not be able to do what is expected from the society. He may have that kind of difficulties. So to integrate the patient with those kind of rehabilitation work, that comes under the rehabilitation. So curing the mental illness, that comes under the curative role. Then the final one is providing any kind of vocational rehabilitation or any kind of occupational rehabilitation, that comes under the rehabilitation role, so that the patient can independently live in the community without depending on any of the family members. So the patient can earn money and he can fulfill all his needs. So that help also the social worker can provide. So to summarize this, all the four roles, what is curative role means? We address the existing illness. Preventive role, we reduce risk and prevent recurrence or worsening of the illness. And promotive means we work with the positive mental well-being and the protective factors. Rehabilitative role means we restore functioning and we promote community participation of the patient. So in actual practice, these four roles often overlap. So, so it is very important to identify or differentiate these four roles. What is curative? What is preventive? What is promotive and rehabilitative? So moving to the next one. So all these things I have already explained. You can just to have a quick look. What is a curative? So it focuses on assessment and treatment of the current illness. So I have explained all those things. You can have a quick look. So this is about the prevention. In prevention, we also work with the ASA workers, ANMs, CHOs, teachers, police, and community volunteers actually. So it may not be possible for us to every time to go to community and identify or prevent the mental illness. So if you work with these ASA workers and if you provide them how to identify a person with mental illness, the early signs and symptoms, they can identify the people and they can help you to get the patients. So they can act as a referral agent. So there's a training the ASHA workers, ANM, CHOs, which is very important. Even the currently the Department of Psychiatric Social Work is doing this project actually. We are with this Dr. Prasant and Dr. Naren sir. So they have taken one project actually. In this project, we are the Department of Psychiatric Social Work is training the ASA workers, ANMs, and CHOs how to identify a person with mental illness in the community. So that comes under the prevention. Promotive role, like I have explained, it is to work with the positive mental health. Where we improve the person's resilience, where we improve the person's with the self-esteem. So those things comes under promotive role. Rehabilitation, I have already explained. This is a very, very simple and quick look that one can see the differentiation, curative, preventive, promotive, and rehabilitative. So coming to the role of psychiatric social worker in general hospitals, what we do in the general hospitals, this general hospital means the GHPU, the General Hospital Psychiatric Unit, where there is a Department of Psychiatry, where what kind of role that the psychiatric social worker can play. Right? The psychiatric social worker is not restricted to psychiatric hospitals, right? Like a CIP or the Manch. Even the psychiatric social worker can work in general hospitals. Also, it has a lot of what is psychosocial problems. The patients are coming with a lot of psychosocial problems. For example, patients with chronic medical illness may experience anxiety because of for example, a cancer or tuberculosis or the diabetes. So these are all the chronic medical illness, no? So because of this, the person who is having this physical illness may develop anxiety, may develop depression, may develop financial difficulties because it requires a lot of continuous medications. So the family may go through a lot of stress also. So the loss of employment because of this chronic illness in nature, so they may lose their employment opportunity and difficulty in adjusting with the illness. So the psychiatric social worker can address all these problems in general hospital psychiatric unit, or the psychiatric social worker can also work with other department. For example, a cardiology department or the eye department. So the general. Yes,
Santil
yes.
sir, sorry for interruption because it's this call will end in 1 minute. So we can join with the second link what we have shared in this, so that with this slide we can continue.
So how much time we have? Actually, I have completed half of the presentation is over. So whether we will be able to complete
15 minutes. No, it's this call will end in 1 minute.
I think 15 minutes I will be able to complete.
It is requested to all to kindly join with the second link.
We are having just less than 1 minute only.
Then
So
we may have to join
please
again.
join with the second link.
So Atavla, kindly share the link actually.
Sure. I have shared you, sir, on the WhatsApp.
Okay. So I will continue till it is ending.
Sure.
Okay. So moving to the next Yes, I have joined. Just sharing the screen.
Thank you all. Thank you all.
So, Atula, can you tell me whether the present is visible, the slide?
Yes, sir. It's visible, sir.
Can you see the
Visible,
medical
it's
social
visible.
work slide?
Yes, sir.
Medical social work, right?
Yes, it's visible.
Uh-huh. So medical social work is the application of social work knowledge. Like what I said in the beginning, for psychiatric social work, we apply the social work knowledge and the skills in the field of psychiatric social work can be called as a psychiatric social work. The same thing which applies here also in medical social work. It is the application of social work knowledge and skills in healthcare settings. So this is about medical social work. So medical social worker address the social, psychological, and environmental problems associated with physical illness. So only difference is actually we are working with a person with a physical health problem and seeking medical treatment. So for example, a patient may have a serious illness, but may also have financial difficulties, lack of family support. The family may not support the person. They may have difficulty arranging follow-up care. So here the medical social worker helps identify these problems and connects the patients with appropriate resources and services. So this is the the meaning of medical social work and the role of medical social worker. So to discuss in detail, I'll move to the next slide. Role of medical social worker, you can see. So the medical social worker works as a bridge between the patient, family, the doctors, so hospital, and the community. The role may include starting with the psychosocial assessment. What I have explained in psychiatric social work, that the role starts with the psychosocial assessment. The same thing which apply here also. We start with the psychosocial assessment, and after assessment, after identifying the problem, we may provide counseling. We may do family intervention. We also help if the patient who is having some difficulty in terms of financial and welfare assistance. We provide financial assistance also. We also help the doctors or the treating team in terms of discharge planning that we make. If there is a requirement for a referral to any other hospitals, that also comes under the responsibility of a medical social worker. And we also do some kind of networking with the NGOs and patient advocacy. So rehabilitation and continuity of care are also important, and which comes under role of medical social worker. Then what is the difference then? There is medical social work and psychiatric social work. Medical social work and psychiatric social work have many similarities. Both involve psychosocial assessment, like I said, and both we provide counseling. Hello?
Yeah, sir. Actually, your presentation has been stopped. You have
The slide is not visible. The slide is not.
Slide is not moving. 1 minute.
Yes, sir.
I'll share. Now, Atola now.
Yes, sir. It's sharing.
Which slide you are seeing, Atola? What is the
on medical social work and psychiatric social work?
Yes. So medical social work and psychiatric social work, it has a lot of similarities. Both involve in psychosocial assessment, counseling. We work with the family, and we do resource mobilization. We also involve in referral, referring the patient to any other centers or hospitals. And we also do some kind of advocacies and help the patient if they have any financial difficulties. those things that we are addressing, and both in medical social work as well as in psychiatric social work. The main difference is the area of specialization. So very simple. Only the specialization is the difference. Otherwise, all the roles and responsibility which are very much similar. So medical social work primarily focuses on psychosocial problems associated with the physical illness, whereas psychiatric social work focuses specifically on health and mental illness. However, there is a considerable overlap because physical and mental health are closely connected. Next one is role of PSWs in CGC. Athola, the slide is moving, no?
Yes, yes, moving.
So the role of PSW in CGC, that is a child guidance clinic. So here we have very important role, and also we are going to work with different kind of stakeholders or the people in child guidance services. We should never look at the child in isolation or to work the patient in isolation. This brings us to the broader area of medical social work. We work with parents, we work with teachers, we work with the community and other social agencies to understand the patient's problems, because a patient who is having a child, right? Sorry, I'm saying patient, a child or the adolescent who is having problem, the problem may be related to school. For example, a bullying. So bullying can lead to anxiety disorders, right, or any other mental health problem for a child. So the problem is not with the patients alone. So there is a problem in the school environment or the friends. So we have to work with teachers and the adolescents friends here. So to understand the patient's illness. So the role of social worker is different in child guidance clinic. So coming to role of PSWs in community mental health. This is very important area. Community mental health changes the way mental health services are delivered. So instead of expecting everyone to come to a psychiatric hospitals, the services are taken closer to where people live. Right? We are going to community. We are going to address the patient's problem in the community itself. In their doorsteps itself, we are going to address, because many of our patients are coming from poor socio-economical status. They have difficulty in accessing the treatment. For example, where we are working in CIP, Ranchi, many of our patients are coming from all the way from Bihar, UP, and other neighboring states. And all of them are coming from very, very poor socio-economical status. So maybe for the first time they can take money from their neighbor or relative, and then they can all the way Bihar to Ranchi they can travel, but they cannot travel every time, because the treatment it is required for every month. The patient they have to come for a follow up, and then they have to take medications continuously. So it is not possible. Whenever the patients who is having severe symptoms, they will come to CIP, and we will admit the patient. After discharge, the patients, they are going back to the community, but they don't take medications because the family members are not able to afford the medications cost. So and then they have difficulty even for the travel expenses also they are not able to meet. So in that situation, what is important here is the community mental health. Take the services. Don't expect the patient who come to your hospitals. You go to their place and then you give free medication, treat them. So all those things that is happening in the community mental health. We also very closely working with the community mental health program wherever it is existing. So we are working with the social worker, whether they can help the patient. Whether for follow-up, instead of coming to CIP, whether the patient can go to that respected community mental health program. So that is very easy because it is very close to the patients. So that way that you can ensure that the patient is taking regular medications. So this community mental health is very, very, very important subject. So the social worker is playing very important role here. So the psychiatric social worker may work with health workers, right? The primary health centers, doctors or nurses, where the primary health centers can take up the cases, and they can treat the patient in their primary health center itself, instead of sending the patient to CIP kind of hospitals. So they can help us, right? So we can also work with the schools and the teachers. So they can that comes under school mental health program. They can identify the students who are having mental health problems. So working with the school teachers is very important. We can also work with the NGOs and community leaders also. They are very important stakeholders, because they know in which street or in which village the patient who is having mental health problem. For example, a patient who is having schizophrenia, maybe because of lack of awareness, the patient may not come to the hospitals. So the community leader who can identify those kind of people, and they can act as a referral agent. They can refer the patient to CIP. So to do that, what is important, the community leaders, they should know what is mental health problem, what is schizophrenia, what is bipolar affective disorder, so that they can help us in terms of identifying the people. So we can also work with a lot of stakeholders, for example, self-help group members, village leaders, and youth volunteers. So what we can do is we can give some kind of training how to identify a person with mental health problem. For example, a common mental disorder. For example, severe mental disorder, which we are doing. We are very much, actually, we are working in the community. The CIP team, from the Department of Psychiatric Social Work and Clinical Psychology, we are going to community to create awareness, and we are working with a lot of stakeholders, actually. Every time when we go to community, we are working with the different stakeholders. We are just giving knowledge how to identify a person with a mental health problem. So that comes under social, role of social worker. You can see the role of social worker can work very closely with the DMHP program, district mental health program. The social worker can do a lot of school mental health program. The social worker also can promote this telemanas. Telemanas is very important, actually, activity the government has initiated. Because all the people, they cannot, like I said, they cannot come to CIP, or they cannot go to NIMANS or any other mental health institution. Sitting in their home, they can only dial the one number, which is toll-free number 14416. So what is the role of social worker is to promote this number. So the sitting in their home itself, they can receive the treatment. They just by dialing this number. So all the mental health problem will be addressed from the mental health professionals. So just dialing this 14416 is enough. So what the patients, the doctor will do is they will provide counseling. If the counseling is not helpful, then they will prescribe the medications, and they will send this medication prescription through WhatsApp. So in their hometown itself, it is very much possible. Now it is not necessary to travel all the way from Patna to CIP, so those things. So suicide prevention is also a part of our mental health program, community mental health program. We are also, this CIP, what we are doing is we are also distributing the IEC materials, where in the local language, we are printing what is common mental disorder, what is severe mental disorders, what is anxiety, what is depression, the signs and the symptoms, and we are distributing in the village. Whenever we are going to village, we are distributing. So that way that they can read and they can understand. So just by creating awareness, using mic and telling the people what is schizophrenia, they may forget after some time. So giving these materials, they can use it, they can see whenever anybody who is suffering from this mental health problem in their village, they can easily identify. Yes, you are suffering from depression, you are suffering from anxiety. So this IEC material is very, very important, which we have already developed. We are also, like I said, we are also training the ASA workers, ANM, CHOs. So those things are coming under the role of psychiatric social work. So scope of psychiatric social work is very vast. Coming to this role of PSWs in de-addiction centers, so what we do, the similar work that we are doing, we are trying to understand why the person is taking substance, what is the problem, why is it, and then we are making psychosocial diagnosis. Then after making the diagnosis, we are providing psychosocial treatments such as motivational interweaving, motivational enhancement therapy, relapse prevention. Also, we are doing the that comes under the role of social worker. Group therapy, also the social worker who is conducting. The social worker is also working with the family. Like I said, the family members are going through a lot of emotional difficulties. So it is very important to address their problem also. We are also doing the occupational rehabilitation and the 12-step facilitation. This one I'm not going to discuss, considering the topic. No, our topic is the scope of psychiatric social work, but I'm not going to discuss the history, how the social work developed, or the psychiatric social work that has developed over the years actually. So I'm just skipping this slide. I'm moving to the training facilities actually. If anybody who is interested in pursuing this psychiatric social work, and there is an option, you can see the history also, how the NIMANS started, when the NIMANS started. So one can pursue MPhil in psychiatric social work after completing Master of Social Work. If you are very much interested in this specialization, you can take it up as a career option, and then you can pursue this course either in NIMANS or CIP or LGB or any other mental health institutions which is offering this MPhil in psychiatric social work. Now the nomenclature, it has changed now. So one can definitely consider. So you can see here, I have mentioned the RINPAS also, but they are offering MPhil program. Where the Bhupender sir is working in Haryana, there is also MPhil in psychiatric social work is there. So the scope is very much actually. So after my presentation also, you one can understand actually how much the important role that we are playing, the psychiatric social worker. What is the challenges? It is going with what Dr. Reddy sir has presented. No, Kannappa Sethi sir. The same things. The psychiatric social worker is facing stigma. There is a poor manpower is there. Even in CIP, it is existing. We have a lot of patients. We have around 450 patients, but we have only the MPhil psychiatric social worker trainees. No, only 30 students are there. So to work with 450 patients with mental health problems, with only 30 psychiatric social worker, so one can imagine. So there is a shortage, right? The manpower crisis is there. Heavy caseload every day. Our students who are coming to us and then expressing that no sir, we are not able to manage the caseload every day, that we are getting referrals. So that is another challenges that the psychiatric social worker is facing. Limited rehabilitation centers. There is a major role which I discussed. Curative, preventive, promotive, and rehabilitative. So when it comes to rehabilitations, the facilities are very, very limited. Poor community resources is another problem. Even if we are trying to help the patients in terms of availing the resources, the financial resources for continuity of care, the patient should take regular medications, right? So it is very difficult. We don't get that kind of financial assistance from the government or NGOs. So it is very difficult for the patient who is having mental health problem and continue to afford the medications cost. The medication cost may come around 2,000 to 3,000, which is very, very difficult. So that also comes under challenges faced by the PSWs. Family resistance, actually, they don't come for any therapy. Generally, they don't come, or family intervention. If you call any family member, they don't come. For the kind of challenges that we are facing, we don't admit the family member here in CIP. We have one separate centers for that family members can also stay with the patient, but we don't generally admit them. So if you want to do any kind of family intervention, what you can do is you have to call the family member and contact them through phone only. And imagine a patient who is coming from very remote villages, not having smartphones. So it is very difficult to address the family issues, or difficult to do this family intervention through phones. And then if you call them for a family therapy, definitely they don't come. So that comes under family resistance. So it is very difficult for us to work with them. Poor follow-up, like I said, they may come whenever the patient who is having severe mental health problem. But after once the patient is improved, no, they don't come. They will wait for the next relapse to happen. After relapse, again they may come to CIP. They may request for second time admission, third time admission. So the continuity of care, no, that is not there. The taking regular medications, so that is not there. So lack of awareness about PSWs is another major challenges. Future scope of social work, you can see you can work in all these areas. You can work in community, you can work in district mental health program, you can work as the psychiatric social worker can work in tele-mental health, the psychiatric social worker can work in school mental health, workplace mental health, disaster, geriatric. So the list is very big actually. So the social worker has all the scope. Job opportunity, many people actually now they are trying to get into aims, so after completing this medical social work or psychiatric social work, so one can get the this kind of a permanent job in all these places, PJ Chandigarh, JIPMER, ESI hospitals, AIMS, all the AIMS. So these are some of the areas. Coming to conclusions, in India, the PSW profession still in its infancy and in developing stage, but it has a definite preventive and curative functions in society. Psychiatric social work is an indispensable component of multidisciplinary mental health team. I often say this: if the social worker who is not involved in the mental health, multidisciplinary team, the treatment is, I would say, incomplete. Right? So you are not addressing the social problem. You are not addressing the family problem. So the patient may relapse. So the treatment is incomplete if the social worker who is not involved in the multidisciplinary team. So social worker who has very, very important role in not only in psychiatric settings, but also in other places also. So by addressing psychosocial determinants, strengthening families, mobilizing community resources, and promoting equity, psychiatric social worker bridge the gap between medical treatment and successful community reintegration. So thank you for the patients listening, and thank you for the opportunity. I thank all the office bearers of ISPSW for this opportunity. Thank you.
Thank you, Dr. Senthil sir. It's a very informative and nice presentation. You have covered almost all the areas, all the aspects of psychiatric social work, where the psychiatric social worker work, what the challenges they are facing, how to overcome with these challenges, and what are the job opportunities. That is very important when for the new buddies who are coming in the field of social fraternity. So thank you so much. Thank you so much, Kanappa sir. Also, there is one question came by Babu Shri sir, that what is the role of social worker in hospital ethical committee member? As an ethical committee member, what is the role? So I want from the both of the speakers, anyone can take the question. What is the role of social worker in hospital ethics committee member? Ethical committee member.
Can I take Dr. Sandil now?
Yes, I can take actually the ethical committee when we work with the patient. One is the confidentiality is very important. One cannot breach this confidentiality. That comes under the ethical consideration. The boundary also, I would say, it is very important actually. We cannot cross any boundaries. So we should know the limitation. How that is another one. If you want to, if you are thinking of doing any research program, that comes under ethical considerations. Any research actually you have to get the approval from the ethical committee. So the ethical committee will check your research topic, and then they will see whether there is any what is a problem in terms of identification of the patient, or you in your intervention plan, if you have planned anything in your research, whether that will harm the patient. So those things that they will ensure. This much that I remember now. So right now, Dr. Kannappa, can you add anything? If I have missed anything.
Yeah, actually, I said, can I take the question? I wanted to answer it, so you answer it. Okay. Yeah. So along with what Dr. Satil said, basically the role of social workers in ethical committee to check for any sensitive informations, and especially any social work or social issues whether how the researcher is going to handle it. So any child sexual abuse or any family related issues, any confidential issues or any social issues, and informed consent forms, and basically translations of tools, and whether the tools are particularly translated in Indian culture or Indianized or not, whether we have taken any and probably the copyright issues or permission from the authors, or even whether the particular informed consent forms have been translated in local languages or not. While translating the the information from English to the local languages, whether the appropriate words we have used it or not, sensitive words we have captured it or not. So how best we can utilize basically the jargons into local languages. So all those things are very important for social workers to identify and to give information to PIs or even the researchers who is going to present his or her proposal there.
Hope you all got the answer, and thank you so much. It's a very nice question, which is pertinent in current scenario. Uh, one question again came that what are the job opportunities, by give a question by Akbar ji, that what are the sorry by Rahul, what are the job opportunities when the social worker is working in field of medical social work or psychiatric social work without doing MPhil? If he is only taken the specialization as a medical and psychiatric social work, what are the job opportunities? So over to the speakers.
So I have also shared this screen. No, so for a person who has completed Master of Social Work, there is a scope. Right, they can work as a medical social worker, and this recent times, the AIMS is going for recruitment. So in AIMS or Chitmar Pondicherry or PJ Chandigarh or ESI hospitals, or even some of the other state hospitals and central government hospitals, they are recruiting. So this is about the government job where the social worker can work even with Master of Social Work. It is not necessary to have MPhil in psychiatric social work. Only this MSW itself sufficient to work. And in the private hospitals also, there is a scope. The social worker can. One is in the government sector, another one is in the private sector. So MSW itself, it is sufficient with the specialization, medical and psychiatric specialization, but some amount of experience, actually 2 years experience, 5 years experience, actually they are demanding. For a medical social service officer, grade 1, actually 2 years experience in hospitals. And then for grade 2, no, for 2 years, and grade 1, 5 years experience, actually they are asking for. So for a beginner, actually you can start your career in working with any hospitals. So this is very clear. So MPhil is not necessary to work as a medical social worker. MSW and specialization in medical and psychiatry, that is sufficient. Over to Kannappa, if you can add anything.
Sufficient answer, Sandip.
Okay.
Okay, Rahul, hope so you got your questions answered. And one of our participant has requested that next session should be on School of Social Work. Definitely, Akbarji will try to have our next session on School of Social Work. Thanks for your idea and thanks for your suggestion. Charing Bhag sir is recommended that recovery model is important for patient recovery from illness. Would you want to ask any question, or it's your suggestion, or it's your contribution?
I think it is a contribution. I feel it is a contribution. Recovery, I think the rehabilitation and the recovery, which I have also discussed.
He wants to know that recovery model. What is the importance of recovery model in terms of social practice in clinical and community setup?
Recovery model as such, actually, I'm not able to recall now. Maybe I will take a help of Kannappa, whether you can add, or we can, if we are not able to answer now, we can address in the next session. But right now, I don't know.
Correct, Sanjay. Yeah. So there are 2-3 recovery models in terms of Again, all of them are part of rehabilitation. There are various recovery models in terms of biopsychosocial and different models. But as of now, as I'm unable to recall particular author or proponent names. In case if they need any specific class on this for rehabilitation or recovery models, probably we can have it.
In the name of rehabilitation, it is a very vast topic. If there is any what is it chance, definitely we can have one what is it program on this
Yeah,
topic.
hello.
Cheringji, in the recovery model, if I want to contribute, I will say that
Prashant,
it is
sorry to
about the
jump. Prashant, sorry
yes,
to jump.
yeah,
I
yes,
think we
yes,
are
yes.
trying to cover each and everything in one session only, while we have planned to have concurrent sessions. So I
Okay,
think
then we'll take this
yes,
in the
focus on the
concurrent
topic
session.
which is scheduled for today, rather to covering
Okay.
all social work perspectives in one go only.
Okay, fine, sir. Then we'll take this. Definitely, we'll take this topic in the next coming session also.
Any,
Coming next.
sorry to interrupt, any further questions, I think kindly you can ask the participants, who can send it to us, and then we can answer considering actually we have our one program today, we have to leave, me, Dr. Prasad and others from
This is
CAT.
actually this
So,
the start of this program. We definitely in every month we will have this academic lecture series. So we will take the question in that also.
So thank you, Dr. Prasant and all the office bearers once again. Very nice to what to say work with Dr. Kannappa also on this particular session and a particular topic. Thank you very much. So may I leave now?
Thank you all. Just a last question, what is very pertinent with this topic by Dr. Mool Raj sir. I want that we will take this topic. It will helpful for others also. That as per the now NCHP guideline, Master of Psychiatry Social Program is there as an alternative to MPhil. Um, yes, I think so. It's
Yeah,
alternative, and
that is actually
I
alternate.
want
Yeah,
suggestion.
that is alternative MPhil, especially for psychiatric social work, graduates. It's called as MPsych, like Master of Psychiatric Social Work.
Oh, thank you, Kanappa sir and Dr. Senthil sir, Bhupen sir, to be here. And
Okay, thank you, sir.
with this, I want to call Dr. Naren sir for the vote of thanks to all. Thank you so much, Dr. Naren sir. Over to you.
Thank you, Prashant. Hope I am audible.
Yes, sir, you are.
Yes. First of all, I would like to express my sincere gratitude to association for giving me opportunity to deliver a vote of thanks. Such a nice program today we have conducted. I would like to extend my heartfelt appreciation to Office Bearer of Highest PSW and CIP for their support and granting the permission to organize this program. I am deeply grateful to our both extreme speakers, Dr. Kannappa sir or Dr. Senthil sir, for their accepting our invitation and deliver a insightful lecture despite the short notice. Thank you very much, sir, for your valuable time and contribution. I would like also express my sincere thanks to our moderator, Dr. Prashant Kumar, for conducting the session so effectively, ensuring its smooth flow. My special thanks goes to Mr. Ataullah for his excellent idea, dedication, and tireless hard work for organizing this program. Without his support and effort, this program could not have been possible. I would also like to thank to all the participants. Despite the short notice, we had more than 100 participants who had joined today. Your presence and active participation made this program a great success. Finally, I extend my heartfelt thanks to everyone who contribute directly and indirectly to successful this program and event. Your support and cooperation is sincerely appreciated. Once again, thank you for all your valuable time and participation. Have a wonderful night. Good night to all. Thank you.
Thank you all. Thank
Thank
you
you,
all.
sir.
Thank you. Good night. Good night.
Thank you all. Thank you, Mullah sir.
Thank you, Bindra sir. Dr. Prashant, thank you. Thank you, everyone.